Hi, I'm Dr. Jason Miller. I'm a physician with Clinical Trials of Texas. I'm a psychiatrist and a family practitioner, and currently we're working on a study looking at teenage depression. Interestingly, about teenage depression, when we think about teenagers, we think about kids who are developmentally, they're arriving at their identity, they're having thoughts about who they're going to be for the rest of their lives, and probably not surprising to any parents out there, they're moody. They are sometimes rebellious, they sometimes can cause some difficulty in the family, and that's all pretty normal behavior. And if you're a parent, you've often wondered, what's the line that they have to cross before it goes from what we think of as being kind of regular teenage behavior versus something else? At what point are we thinking about something like depression? So the first thing to know is that teenage depression is actually really pretty common. It turns out that it affects 1 in 10 teenagers, and that in fact, 1 in 4 teenagers will experience up to mild symptoms of depression that's different than the regular kind of teenage angst or teenage sorts of moodiness that we might think is a normal state for teenagers. Consequence of that is that at times parents will seek treatment. It turns out, however, that the treatments that are available for adults aren't available for teenagers and children. As a result of a lot of studies, there's a lot of scrutiny about the treatment of teenagers and children that's very different than for adults. The FDA now requires that we do a lot more studies to make certain that medications are safe and effective for teenagers and children, and well, they should, because we know that teenagers and children aren't just small adults. They're in fact got different physiology, different brain chemistry that makes things very different for them. When you think about teenagers then, what you'd wonder about is, gosh, if I take them to treatment, what's going to happen? And unfortunately, the studies right now show that a lot of teenagers are undertreated, probably because there's not a lot of drugs that are available for their treatment right now. And when they look at it in large groups of people, what they find is that only about 2/3 of teenagers who suffer from depression actually get treated, and of that group, greater than half of them never receive any follow-up treatment. So they might make it to their family practitioner or to a psychiatrist, but then after that, for a variety of reasons, they just don't make it to any sort of a follow-up. So as a consequence, a lot of teenagers go untreated who have depression, despite it being a very common thing that teenagers find themselves struggling with. When you think about teenagers versus adults in terms of their depressive symptoms, one of the truths, again, is that teenagers aren't just small adults. When we think of adults who have depression, we think of people who are down, sad, maybe have trouble sleeping. They look depressed. They look sad and down. With a teenager, they may present very differently. Some examples of this. So a teenager, as opposed to perhaps what we think of as being the typical depressive symptom of waking up really early because you've got so much on your mind, a teenager may in fact stay up all night and then they sleep all day. Again, this is one of those things where sometimes teenagers do this because they're just challenging their limits, but the line that you draw is that when this becomes a behavior that's affecting their everyday life in such a way that they're having trouble accomplishing the tasks and goals that they've set out for themselves. Also, with teenagers, changes in behavior that, again, sometimes can look like regular teenage behavior. When they become extreme, you start to wonder about depression. So another example of this would be kind of thoughts about death or dying, not necessarily suicide, but thoughts that are of a darker nature might be a warning sign of depression. Other things that you may notice are teenagers may suddenly have a decline in school performance. While grades for kids a lot of times go up and down, if it's prolonged, especially if there's not a good reason for it, again, suspecting depression could be there. They can also find themselves more irritable than normal. Again, teenagers can be irritable, that can be normal. However, if the irritability is prolonged, if it's of a particularly negative sort, if you find that they are particularly prone to getting irritable if critiqued in any ways or made to feel as though that they're being attacked in some way, then again might be a worry sign for depression. Of course, parents always worry about signs of suicide, and with kids, the thing to look out for are big changes in behavior. So one of the things that you could notice that would be obvious would be a kid who's been a good rule follower, somebody who's not been in trouble, and suddenly you find that they're either using drugs or they're getting into some sort of criminal mischief. We worry about drug use in teenagers anyways, but sometimes the drug use can be a symptom of depression. Another thing that teenagers can suffer with is having inappropriate guilt. So kind of these worrisome thoughts that they're to blame for all their troubles. While that's not an unusual symptom in adult depression, with teenagers it can also be the reverse. They can worry that other people are doing this to them. Not paranoia, but what they are is actually kind of blaming others for their current symptoms and their current situation. The other thing that you can see with teenagers is a loss of concentration. So these aren't people with ADHD or attention deficit disorder. These are people who, because of their mood change, they suddenly have trouble with their memory, with their ability to concentrate, and as a consequence sometimes of that, you'll see a decline in school performance or work performance. The other thing that you can notice with teenagers is it's normal developmentally for teenagers to be very bonded to their peers, to have a peer group that they may actually relate to more than their family. And while that can create some problems with the family dynamic, it's a pretty normal thing for teenagers to go through. In depression, you may notice them starting to pull back from their friends. They're not as interested in doing things with their friends. They may actually create excuses or reasons to not go out, to maybe not even go on dates, which again would be a very unusual thing and can be a warning sign for depression. At Clinical Trials of Texas right now, we're doing a study looking at an agent that's already been approved for adults that we're trying to find out if it's going to work well in teenagers and children. The FDA requires extra study, again, because we want to make certain that these medications are safe and that they work well for teenagers and children. And so as a consequence, we've started enrolling patients right now. If you have interest in talking about your teenager's behavior, even in just getting an evaluation, studies are always voluntary. If you want to come in, have the evaluation, you want to talk to a professional about this, we're happy to do that. And even if you ultimately decide that you don't want to participate in the trial itself, you can get an awful lot of information. We do pretty in-depth testing involving a number of very good and useful scales that we look at behavior that give us a pretty valid way of looking at whether or not a teenager or a child is suffering from depression. With trials, there is some time commitment to that, but once again, one of the things that we know is that teenagers, unfortunately in our current population, are undertreated. So what we're really offering for people is not only will you not be undertreated, but we're really going to go above and beyond. There's a lot of follow-up that takes place, which is a lot more than you would even get from a psychiatrist or even a very good family practitioner. And as a consequence, anybody who's interested, please call our number. We'll be happy to take any of your questions. Even if you don't know if your teenager is depressed or if they've never been to see a doctor about it, we'd be happy to talk with you about it. Once again, my name is Jason Miller. I work with Clinical Trials of Texas. Thank you for listening today. We'd be happy to field any questions you might have.